My name is Veronik Dupont-Chalaoui. I'm the manager for the first line mental health services at the CLSC Les Salles and Dorval-le-Chine in the Sud de l'Ouest de l'île.
I wanted to ask, as I mentioned earlier, both public and private sectors are experiencing, a longer wait time. Where you're located, are you seeing this as well?
Well, actually, what I can tell you is that the requests for mental health services have not yet increased that much. So we are at the same level in terms of waiting time and a request for mental health services that we were before the pandemic. There was a little decrease at the beginning of the pandemic, and now, it came back to the same level. But we are expecting an increase, especially as the pandemics end. So we can see right now a lot of social indicators that there will be, that people are experiencing a lot of distress, whether it is domestic violence cases, whether it is people who come at our psychosocial intake, but it seems like right now what their needs are more psychosocial. They're more in a psychosocial crisis, but I think the mental health part will increase a little later. That's what we're expecting.
Okay, not a problem if this is maybe too difficult to answer, but okay. Do you have any, assumptions why maybe you guys aren't experiencing, these long wait lists that many other places are?
We are experiencing long. I mean, we have waiting lists. We've always had waiting lists, but but what I would say is that it's not worse than it was at the beginning of the pandemics. That's what I'm saying. So it's pretty stable in terms of requests for mental health services. And as I was saying, I think people are more in a survival mode right now, than in the pandemic is something that we've never seen. So at this point, people are just trying to survive. But I think that after the aftershocks, then we'll have more requests for mental health. But we do have a lot. I just want to be clear, just not that much more.
Thanks for explaining this. And, maybe if you guys do experience, maybe a flood in clients wanting your services, mm-hmm. Is there any kind of, how would I phrase this? A plan of action, I guess, for how you guys would like to deal with the increase in clients?
Well, what we're experiencing right now is people who are very isolated and anxious because they do not have access to their usual community support, especially the elderly population. Usually, they have like community centers where they go, they meet, they have some activities, and they do not have that anymore. So we have we have transitioned to virtual mode for a lot of intervention, and we have put together some groups. And what we see is that the need to connect with others and to answer anxiety issues that often come with the isolation, that this is really helpful for people. So we have put together a group a group to treat anxiety related to COVID and related to the social isolation that comes with COVID, and the fact that people do not have what they usually have for support. And for now, this is working well, and we are giving it more and more as the request comes. So we increase the frequency. So that's one of the ways that we found to answer the special needs that we've identified during the COVID.
Thank you. So these groups that you mentioned, are they free services?
Yes. All our services are free. So we offer individual sessions. Just so you know, we're a multidisciplinary team. We have social workers, psychoeducators, psychologists, sexologists, nurses, all specialized in mental health. And we offer both individual services. We have a short-term mandate, if I can say so. It's about 12 meetings that we offer. And we offer groups also. So what we found, as I was telling you, is that group therapy at this point really answers a dual need, the one, say, social isolation and anxiety.
Thank you. And are there only, is there only group therapy offered, or is there also one-on-one?
No, there are individual services. So we also offer one-on-one, and it's, as I was telling you, it's about 10 to 12 meetings that we offer. That's the one-on-one meeting.
And sorry, go ahead.
I just wanted to say that people also have the opportunity to come to the psychosocial intake. That is, we have 2 social workers in each CLSC open every day to address any crisis or situation that our population would request.
Is this maybe for people who need like immediate services?
Well, people who need immediate attention. Yeah.
Okay. And for anyone, experiencing maybe an intense mental health crisis where they need attention immediately, is this where you would guide them to, or is there somewhere else as well?
Well, there are crisis centers for people who are in crisis and need intervention right away. So for our territory, for the West Island, there are actually 2 crisis centers. For LaSalle and Lachine, it's the crisis center L'Autre Maison in Verdun. And for Dorval and all the West Island, it's the West Island Crisis Center. So they answer immediately and can provide immediate services. And it can go also to housing for a few days. It's not if the people not if the person has a housing crisis, but for people who have a mental health crisis, then they could be housed there for a few days.
Okay, great. And if this is
sometimes from the psychosocial intake, when we see that the person's in crisis and need immediate attention, we will make a personalized transfer to the crisis center to make sure that they have the services they require.
Great to hear that. If this is out of your jurisdiction, not a problem, but would you maybe know how many crisis centers, if any, there are downtown?
I don't know, but I can look online if you want, but there are crisis centers. I know that each territory have a crisis center that is related.
Okay, is there a specific name for them?
Crisis centers.
Okay.
Yeah.
I'll search that. Thank you.
Yeah, they're not, people don't automatically know about it, but everybody has access to them.
Okay. Great, thank you. And so you mentioned there's 12 free sessions. If someone maybe needs more support, long-term support, where would you turn them to?
Well, there are actually 2 options depending on the kind of support that they need. There are some community resources that offer long-term services for people who have mental health problems. So that's a possibility, but we also have our partners with the specialized services at the Douglas Institute. So there is a panoply of external clinics that can also provide some longer term support with psychiatric support. So we work hand in hand. So we would discuss the case with our partners and manage that they kind of have access to more specialized resources if need be.
Great.
And if they want to also, it's not everyone that wants, there's that want to have specialized services. So yeah, so depending also always on the person's needs and objectives, you know.
Of course. Are these places that you guys are in partnership with, are they publicly funded or private clinics?
The Douglas Institute, it's public.
Okay.
Publicly founded, yeah.
So their services are free as well?
They're free, and also some the community resources that I was telling you about are also free. We also have, depending on the economical situation of the person we're dealing with, I mean, some people have no resources at all. Some have limited, and there are a series of resources that can modulate the prices of the psychotherapy session with the person's salary. So if we see that the person can continue, so they and want to continue, and they can pay some, but not the whole price that usually, you know, in private that it pays, we will direct them towards those places also. So there are quite a few in Montreal.
Okay, great. That's good to hear. Thank you.
Yeah.
I guess maybe one of the last questions I have, I'm not sure if you can answer this, but I know that the government has been giving more funding towards mental health services, especially recently. If maybe the government was to give even more money, would there be any specific services that you guys would want to funnel this into?
The first thing that I want to tell you is that they give us some money, and we see that we see the money, and there is some there are some jobs that are being, you know, more jobs that are being offered in our teams. And if you could make, you know, tell people that we are hiring and we need the new the newly grads to come and work with us. If, you know, we offer a great working environment, there's supervision, there's training. So, you know, we really need you guys to come work with us. So if you could, you know, take the opportunity to, you know, tell that to your colleagues, it would be great. It's a time right now, and it's kind of the fact that we do not have in person, like forums to, you know, usually there's like recruiting forums, and there are places where people can, you know, go inquire about different type of jobs, and we do not have that right now because of the COVID. So newly grads, we don't have access as much to the newly grads as we would, you know, usually. So I'm just saying, you know, if we're a great working environment, if you could tell your fellow students to come and apply at our CS in our mental health program, that would be great. But it's the investments are really for first line services. So for the CLSC right now, that's where we want to have access to, we want the population to have access to our services. So that's where the funding is being directed at this point. I'm not in the secret of the gods, so I can't tell you exactly, but I know that our teams have a few more openings.
Okay, thank you for explaining this. I know you have to go, so I just have one last question, if I could sneak it in.
Fine.
So are you guys, I guess, kind of experiencing a shortage in employees?
Well, actually, it's not often that our professionals or workers are going through the same things as the clients, if you know what I mean. So we also have, you know, we're humans. We are experiencing distress with the pandemics. You know, we have family situations. So I would say that it's also hard for our employees to be working in that context. So yeah, we actually need more people to come work with us. And so we do have certainly, I don't know if I can't compare it with before because I wasn't there before, but what I can tell you is that we need people to come work with us. So we do have a lot of openings.